Did you know that women are at an increased risk of heart disease when they go through menopause? That heart disease is the #1 killer of women after menopause. Well, why do women have increased heart disease when they go through menopause? Women experience an increased risk of heart disease when they go into menopause due to the loss of the cardioprotective or the heart protective effects of estrogen. Estrogen has the beneficial effects on our lipid profiles. The lipid profile is your cholesterol panel, or the lab work that give you your LDL, your HDL, your triglycerides, and their small dense particles and the inflammatory markers that the artery is affected by. These affect the arteries or the vascular vessels that bring oxygen and nutrients to the vital organs such as your heart, your brain, the rest of our body. Estrogen has an beneficial effects on your insulin sensitivity. Well, what does that mean? Well, when you eat, you want your blood sugar and nutrients to be absorbed properly into the blood vessels and brought to the proper areas of the body everywhere that we need these vital nutrients, such as our muscles and our bones and our brain and all of even our sex organs. Well, insulin sensitivity helps with the blood sugar regulation and with our weight regulation. Plus, it affects how you feel, you sleep, your energy, and to name a few. With menopause, which is the loss of estrogen, you get an increased risk of central obesity, that fat tissue in that midsection, that muffin top, which we all want to avoid at all cost. Menopause also elevates cholesterol and triglycerides, and it also decreases your good cholesterol, which is the protective part. Menopause leads to insulin resistance, which causes breakdown of the body and the vital functions of our body. This leads to things like heart disease, dementia, loss of vitality, our muscles, our bones, our skin, and more. During menopause, when your estrogen diminishes or is absent, your blood vessels become stiffer or more inflamed. This leads to things like hypertension, vascular aging, poor circulations to a lot of our vital organs. Even our skin, we want to look younger and be more supple. Well, the American Heart Association highlights that menopause transition is a crucial period for accelerating cardiovascular disease. It emphasizes that the importance of early prevention during midlife due to this loss of estrogen that results in increased artery stiffness and artery dysregulation or hardening of the arteries and high blood pressure. Women with premature menopause or early ovarian insufficiency or even early hysterectomies with their ovaries removed have an even higher risk of heart disease due to this prolonged absence of estrogen's protective effects. Hormone replacement therapy could decrease the risk if initiated early, but it needs to be individualized and based on the person's overall risk profile because not everybody's the same. We're all different. So in summary, the loss of hormones increases the risk of heart disease in postmenopausal women, primarily due to the loss of estrogen and other hormones. This leads to more cardiovascular changes, such as affecting your heart and all the blood vessels. Plus, it increases vascular aging, higher risk of heart attacks, strokes, and earlier death. So early intervention within the first 10 years or earlier with bioidentical hormones along with individualized management is crucial to decrease these risks. If you want more of this vital information to stay smarter, stronger, for longer, check out my website and follow me on social media for up-to-date information that will keep you living longer and performing better.